Hello, right after lunch. Hopefully we'll keep you awake. So I'm Dr. Dusan Sajic. We're going to be talking all about regenerative medicine, okay? And talking about what are some of the available tools that we have and how we can use them to really shape what we see for our patients. How many are doing regenerative medicine right now? Just because I want to keep it interactive. You'll see during my talks, we'll talk because it's all about you. We just had the mentalist who said it's all about you, so I got to keep it about you as well. So we do a lot of research. We have a research center in our institution. I'm a professor at McMaster University, and we have our fellowship director program for cutaneous laser and surgery. And our primary goal is really looking at regenerative aesthetics. Now, this program itself is sponsored by MERS, and we'll go into sort of really the portfolio there and what's available, but we'll also touch upon some others. And again, if you have questions in the crowd, how does this integrate with what I'm doing now? Please feel free. Again, this is your forum. I'm just here to help sort of guide you, and hopefully we can sort of all help our patients together. So we're really going to go using multimodal approaches. I'm big into that. That's what we do, because aging, who thinks aging is one thing? So if it's not one thing, can we have a silver bullet? Right? So it's really that multimodal approach, seeing where and how aging is shaping. We're starting to get into a new era where we can actually track it and we can molecularly define, you might need this, you might need more of that. That's coming. That's coming. We're getting into that really personalized medicine. But for now, we know sort of which each of the things target. And by combining multimodal things, we can also help our patients look their best by activating their own cellular physiology. And we're going to talk a bit about how Radiesse, how all therapy, and how some of the other products can help work with your skin, with your tissue, to really restore what you've lost. And then just presenter disclosures. So these are the companies that I've done research for, spoken for, had grants for. You can leave that there. And like I said, this talk itself is sponsored by MERS. So the science of aging. So we all know it's coming. I tell my patients, or sometimes I say, if we all didn't have it, would we say it's normal? Withering, degradation, falling apart, losing structure, losing function, right? The only reason we say it's normal is for two things. One, because everybody gets it. So how can you be not normal if everybody gets it? And two, and I think this is also very important, and where we kind of as practitioners have to dance a fine line. If we call it a disease, guess what happens? Exosomes, out. Regenerative medicine, out. Because now it has to be a drug, right? Because if you define something as a disease, you need to treat it with a drug, and then it has to go through the full regulatory stuff, and then it's going to be a lot harder to do off-label stuff, and it's going to be a lot harder to do personalized medicine. So just keep that in mind, right? And we know it's coming for us. And it's not only coming in this linear fashion that is often cited, but scientists at Stanford just last year, who's seen this study? Anybody know? Is this the first time you've seen it? Hands up, hands up, who's the first time? Yeah, a lot of people say this when I talk. It comes for you in big hits. So around your mid-40s and in your 60s. So just like, you go from being like a 10-year-old boy or girl, you check 2-3 years later, you'll look a lot different. And so who has experienced that with either you or patients or whatever when they come in? This last year, I don't know what happened, right? That's what happened. We have 81% of molecules showed significant shifts around age 44. They looked at 135,000 different features, from proteins to mRNA to everything else. And then there's what I call boosters to that. Who loves vacationing? Who's not always the best with the sunscreen? Nobody's looking, right? I'm guilty of it too. This was actually, I didn't even know. This was me growing up. Who remembers, like me, I'm going to date myself, but the 70s and the 80s? Anybody? No, nobody wants to volunteer? Right? We didn't know. There was no such thing as sunscreen. So we went out there, people burned. My parents told me, hey, you know what? You're going to have the world's strongest skin. This is like a callus. Skin doesn't forget. That's what we sometimes forget, even being in the industry. That damage is permanent. There's no real way to reverse it, but we're starting to uncover it. we're starting to transition from being reactive, chasing lines, chasing texture, to really looking at what are the processes. Why is the skin transforming? Why is the skin degrading? Why are we losing elasticity? And how can we get underneath all that stuff to not just paint, but to really fix the structure underneath and hopefully truly slow down aging, okay? And what are our tools? So who uses all of this and then some? I do, so I use pretty much all of it. Who's used most of it? And who's on the fence about some? Like, I'd like to start some, but like not sure. Okay, so we're all kind of in the same boat. So we're going to be talking about these two and specifically how you can combine them. I love combining stuff whenever it's safe. And it's really up to us. We're the ones who are going to be advancing the science about it. And the cool thing is I love different mechanisms. So it's not, is one better, is the other better? No, I'm like, they're different. They're different, and we have to see what your skin is telling us. I tell patients, I have to be the skin whisperer. You know, they laugh because they think I'm like Cesar Millan, like I'm thinking of even bringing a little dog in the office to kind of, you know, loose associations, whatever. But no, but really, outside of that, Radiesse, it's independent of inflammation. It direct contact with fibroblasts, calling mechanotransduction, and that stimulates it, versus with something like cold therapy or HIFU, you're doing thermal damage and then relying on the reparative repair. And so this is one of my favorite quotes. Feel free to steal it. 1 + 1 is 11. And that's the power of synergy. And that's what I tell my patients. When we combine things, we get much better outcomes than we would consider just by one alone. And like I said, for Radiesse, it's independent of inflammation. What does it do? Again, remember that mechanical activation by this round spherical calcium hydroxyapatite binds to the fibroblast and then wakes it up. I tell patients, it's like exercise. We're waking your own tissue up. It's like giving it coffee, and that coffee is producing things like collagen type 3. We'll talk about why that's important. Collagen type 1, elastin, proteoglycans, angiogenesis, and we're restoring, because as we age, that contact with the fibroblasts disappears, it becomes disorganized, degraded. And so we want to bring it back. It needs help. It's like boosting it. It's supporting it. And what happens? Look at the histology. Look at the tissue. And it keeps going. Keeps going for 7 months out. Look at the elastin. Look how dense that is on the bottom on the 6 months compared to the baseline. How much more elastin intensity. And that's protein. That's not RNA. That's protein. Okay? What about, look how much blue you see with proteoglycans. Who likes having a glowy skin? How many patients do they ask about, I want glow. I want to look like I do, but I just want glow. Who's heard that phrase before? A lot of us. Look at that glow. That's beyond what you can see. I can fix the glow with just Vaseline. You're going to glow. Put some Vaseline on, you're going to glow. This is deeper glow. Okay? And then look at those vessels. It's like little light, like to me, it looks like lightning, like in the baseline. Like, look how much healthy vascular tissue you're bringing in. Yeah.
Are those the histological results of one treatment, or was there a protocol series on that?
Yeah, so it'll be, we won't get into the specifics, but we have, if you want to take it, it'll go through it. But yeah, generally you're going to get better outcomes. Most studies show better outcomes if you are stacking it. So one treatment, generally for most things, you're looking at 2 to 3 sessions before you achieve maximal results, right? Okay, and then this is the other thing. Which contract, we were just talking real estate a little bit with some of the other speakers, which real estate agent or builder would you pick? The one that just comes and drops off a bunch of 2x4s on your lawn and leaves and says, we're done? Or one that assembles it properly? And that's what collagen 3 is. So if you're getting a lot of collagen 1, it's great, you got the building blocks, but what's going to assemble it? And that's one of the things that we know Radiesse can do, is produce collagen 3 fibers so that it can not only produce both collagen 1 and 3, it can help assemble them together. So you're getting functional, structural skin that looks better and younger at the same time. And we can see that with even high resolution cameras when we can really track it with things like Vizia CR, we can really minute the tiniest of changes you can see for both wrinkles, texture, and again, oxygenation. Okay? Because otherwise, you're going to be building a beautiful ballroom, doesn't matter where. If the foundation's not set, the whole ballroom's going to collapse. Okay, so again, dermal thickness, elasticity, hydration, and angiogenesis. So that's key. Now, not only that, the one thing that I've loved really about the product is its versatility. So who uses Radiesse specifically in the crowd? Who is thinking about using Radiesse but is not too sure? A couple of people, thank you for being honest. So yeah, we'll talk about it, see if it makes sense there. So we have several forms. So undiluted, meaning just right out of the box, you take it, you inject it. Who does that out of the injectors? Everybody? What about the hyperdilute on the other spectrum? It looks like most of you. Is anybody not doing one or the other? Like either if you're just an undiluted or you're a hyperdilute, anybody in the crowd there? So we're all using it. Excellent. So the power of this is you can either lift or you can regenerate, or if you combine it strategically, and I'll show you how, I'll give you some examples. I'll tell you when you can take pictures. I have some patients that have said, yes, it's okay to take pictures. Some have said no, just if it stays in the room, it's fine. So if you want to take pictures, I'll let you know when. But again, just look at, tell me another product that can do all of this and you can blend it and shape it to what the patient in front of you needs. Because you mentioned sessions, right? What if they come back to you and one part is restored, but another needs boosting? This way you can modulate. You can say, we need to do a little bit less lifting, maybe a little more regeneration. And who doesn't love regeneration? I don't see any hands. Good choice. What would you do here? Who thinks we need to lift? We specifically cut off those, so just the chest area. What about just regenerate? Not volumize, just give it, yeah, exactly. So we can choose it. And this is, if you want to take your phones out, this is going to be, if you remember one slide, this will be it. This is your cookbook. Many people say in a presentation, you remember one thing only. This should probably be the thing you remember. Well, that and regenerate. And how to regenerate right there. Don't worry, it's going to be at the end of my slide too. So if you forgot or if I move on, but we're going to be talking specifically because a lot of this is off-label. But we now have an on-label, and you can probably guess it's in blue. Décolletage. Now officially approved. Okay? So you can do, does anybody do décolletage in the room? Awesome. So who's the cannula people? What about the needle people? What about depends on the day? Maybe depends on the day. I love it. So yeah, it's whatever your comfort is, you can do that. It sounds like we're doing it. 89.3% improvement in severe wrinkles. 93% of severe patients maintain at least improved after a week out after the investigator's rating. And this is generally the injection zone. So, you can, again, if most of you are doing it, these are the landmarks. I'm not going to belabor it too much. Take your time to take some pictures if you need to. But look, we're looking sort of from the xiphoid process to the manubrium and sort of in between. You just draw a nice triangle. Basically, wherever you see the wrinkles, just beware of the anatomy. You don't want to be injecting where you don't need to be. So you always need to know the anatomy. You want to go just subdermal. You don't want to be going too deep. And then combination therapy. So this was in a publication. So you can see here a very nice result of using dilute calcium hydroxyapatite, using all therapy. The shape subtly still looks like her, okay? And I like showing patients ranges of responses because part of it is just like the gym. If you're eating horribly, if you're not sleeping well, are you going to activate your repair processes? No. Gotta be rested. I tell my patients, I'm like, don't even bother coming. You have to dedicate. I want you to eat clean. I want you to sleep well, at least a week before, a week after. Why do I say a week before and after? Surgery. What do they tell smokers? We have a vascular surgeon. What do you tell your smokers? But if they don't want to quit and you have to do vascular surgery, what's the minimum before you see some improvement in terms of healing? Tough question, but at least a week. I'm like, you know what? Ideally, I ask them, why are we regenerating? And that's why I also love regenerative medicine. Why are we regenerating? What are some answers? What do people tell you? I hate to pick. Who wants to say? Anybody? Help me out. Look better. Anything else? Feel better, right? How can you feel better if you're not sleeping? Right? But that also puts the onus on them. So if they come back and they have a result that's like, yeah, I mean, I see it. Many of my patients will say like, I don't like see a difference. I don't know, do you see a difference? Like sometimes even when I walk in a room, if I'm just quickly scrolling through my phone and looking at stuff and I quickly look up and I'm like, what? There's no difference there. But no, even here, you can see a nice definition. If you're an expert, you're gonna see where the difference is. But again, if you want amazing results, you have to commit. It's not gonna be a silver bullet. We have to combine and we have to know what we have to do and how to combine it. Okay? So I'll walk you through it. Look at her jawline. I don't have a point. Do I have a pointer? I don't think I have a pointer. No. You were able, this is all non-surgical. She didn't want surgery. I love surgery. I think surgery is amazing. But some of my patients say they don't want surgery. First thing I told her, oh, this one has laser. Oh, nice. I don't think it will point to. Oh yeah, it will. Generally, typically, surgical results. And that's the first thing I tell them. You need surgery. I don't want surgery. Who's heard that? All the time. So what do? You say, sorry, because this is severe. If you look at the scales, any scale a company gives you, it's 1 through 4, right? What is this, like 20? And that's another thing patients ask me. They're like, well, I don't know, I look worse than that. Like how, like there's not even a scale for me. How am I a 4? Or if I tell my patients, like, if I show them, I'm like, you're a 4. They're like, really? But that's to guide us that they need to see the surgeon. And if they say no, well, yeah, we can help, but it takes time. It's a journey. You need to combine. You need to be all in. It's going to be a journey. And so what we did here, I'll show you exactly what we did, but we did all therapy. We did 2 sessions. 2 sessions about 4 months apart. We did 2 radius gold protocols, and then we also did a hyperdilute radius to really maximize that regeneration. I looked at that graph that showed volumizing, regeneration, and everything between. I'm like, I want the whole thing. This is where we filled. This is up close. And this is what we did. So you are welcome. If you want to use this as your cookbook, this is the one patient that agreed. If we have time after, I can even play her video because you can see her glowing when she's talking about how this made her feel in terms of the confidence she has. She's now traveling everywhere. She's like, I was shy, I was nervous, I didn't want people judging me. The group I hang out with is much younger. I did not feel confident. I am so excited to go. She's going to the Galapagos. She's going to New Zealand. She's going to Bali. All because she now feels confident. So if you have time, I'll play the video. If not, you can always connect me. We're eventually going to post it on the website. You can see that testimonial. And that's why I encourage you. I mean, you guys are doing an amazing job already. The testimonials are really they got to see themselves, right? Here's another patient. A little more subtle. She didn't want as much of an invasive. She's like, let's just get started. And again, I like to show the spectrum. So we did a bit of the gold protocol. We did all therapy. And then we did some Well, actually, yeah, that's what we did. We did the gold protocol, but more diluted. We added some NCTF. We added a little bit of Xeomin. And I like to focus straight through here because who does the Nefertiti lift? Right? So by putting a little bit more and concentrating it here, again, you're getting a little bit of a subtle lift there. Because again, budget, not everybody's going to go all in. But she can see, she saw a nice difference there. She was happy. I'm like, do that once a year. Along with Xeomin every 3 months. She's on board. We gave her a plan. She loved it. I also love combining it with CO2. And I'll show you, actually, there's a video of one of my patients doing a CO2. So again, you can see the jawline, you can see the wrinkles, you can see the lifting. Here's another patient. And this is the other thing, where I'm having these patients that are coming back with sun damage who thought they were lost. I have so much damage. It's pointless, it's worthless. But look at that skin quality. Look at the actinic damage. Like she was, going to be getting pre-cancer skin cancer. We were able to really minimize that, okay? Here's another patient. What do we see? The hooding of the eyes. She said, I always look angry. Okay, do we have time for I have 10 minutes. Yeah. So I'm going to show you the technique. And so So you want to be subdermal and you want to make sure that it's flowing very freely. You're going to have some like little rough spots, but don't be too aggressive. I mean, you guys have all done it. Who wants to keep watching the video, just so I know? And this can be available after. I think we can sort of, if you need, you can just reach out to my Instagram. It'll be on at the end. If I'm always happy to collaborate. That's how we advance patient care, is by collaborating, by talking. Somebody's had to help me out in the past, so I'm happy to pass on the torch. Right? So again, we're sort of going through there. The big thing is you want to sort of go, this is going to be your main area. Your main area is going to be sort of jaw back. You want to be a little bit careful of how much you put in highly mobile areas. But at a 1 to 2 dilution, who's injected 1 to 2 dilution? How does it compare to PRP?
Much better. Much better.
Much better, easier than PRP. Who's truly, like, I'm always worried about vascular occlusion. How worried about vascular occlusion are you with PRP? I mean, you're worried, but are you less worried than with, like, straight on filler?
Yes.
Yeah, right? I'm always, like, whatever I'm injecting, I'm terrified. But who else is doing PRP? And are you super nervous about PRP, or are you pretty comfortable if you're doing underneath? Pretty comfortable. So you've just heard it. Generally easier, the extrusion force is generally easier than PRP. Then anybody else agree? Yeah. And so it's same thing here. So I like to sort of spread it all throughout. And then if I'm going with something more intense, I'll go sort of more on the bottom. Any questions while we're watching this too? It's a good time for questions because it's kind of like an active break. And that's it, sort of, anyway. And that's her after. You can see a little bit of the upturning. Look at the eyes. That's what we talk about. Can old therapy do it? She was pretty happy. Right? And the other thing I personally love about Radius, guess what else is in there? Lidocaine. Guess what I do a lot of? CO2. So this is immediately, oh no. I don't know why that happened. It was good before. Well, we'll hear sound, but look at her expression. Like, I'm going pretty aggressive CO2. She's not sedated. I'm going to be talking to her in a second. Does anybody else do CO2, or you guys do CO2 aggressive? Like, I'm sure. Or who's seen CO2? Who's been in a room with a patient getting CO2? Is it a fun experience where they're like, whoa, that's so fun. I want another CO2 tomorrow, right? They're calling you the next day. Why am I swelling? Why? Like, it's painful. Give me some Tylenol 3s, Percocets, right? Is she flinching? That's why I love it. You got that hyper dilute Radius. It's basically my cheat code for sort of using tumescence without using tumescence. I'm just hyper diluting. That's all I'm doing. And it's got some lidocaine in it, and I'm able to go right after with aggressive. There's another case study. What does everybody think? Worth doing? Maybe I have some cases in there I'm like, just forget it. Should we do this case? Who's like, I don't know how much benefit we'll have. Who thinks like, yeah, we'll get some improvement. Maybe not awesome. Who's like surgery? You have to do surgery. Maybe. That's over 2 years. She fully committed. You know, and every time we come in, we discuss, okay, what's next? What's missing? We look at the other thing that is there now that's published, you can ask me, is we now have a guide on the 4 key pillars of skin health: the skin elasticity, skin surface evenness, skin tone evenness, and glow. And there's mix and match. We have a nice table we just published on it. If you just search my name, skin quality, it'll come up as a pub. If you can't download it, text me, I'll send you the full article. But it's really all about how do we incorporate it each time. Again, I'm the skin whisperer. Feel free to use that too. We're all skin whisperers. Just taking your time and adding it to. Again, everybody's going to differ, and this is why it's in our lookbook. It's a spectrum. Some people respond better. Results may vary, you know, as the stuff says. So I like to give them a spectrum, and I say, listen, if you commit to doing stuff, we can probably get you there. There's about a 90% chance we'll get you there. 10% you're going to think we took your money. 20% that you think I'm a magician. How the heck did he do that? And about, 60 to 80% are going to say, yeah, I'm happy I did it. I look better. I feel better. I'm able to go outside. I would do it all over again if I could. But you have to commit. If you do one treatment, if you just do, I don't know, whatever you want, whatever protocol you want, PRP, I just want to start with PRP. I'm like, you're going to be somewhere in between those first two pictures, probably a lot closer to the first. You might see a little more glow. But if we add stuff, we can make a real change. And then here's some more other examples. So you can see again, jawline, she had old therapy, CO2, and hyperdilute radius. You can see the fine lines on the bottom. We volumized a little bit with her cheeks as well with some volume. And of course, zoom in. Another example. The other thing I do, there's already publications on it. I love using a gold protocol under the eyes. Personally, off-label, not a MERS recommendation, it's just what I do. There's about 100 already cases published in different places across the world using it. Advanced technique, I don't recommend it until you're safe, but it's another, just shows the versatility of the product. So, multimodal, if you remember a second thing, multimodal. It's a combination therapy. No one treatment's gonna be amazing. I love that you guys are having this regenerative medicine. I think, yeah, the products work well together. I use a lot of different products. If I think the patient needs it, I will use other products. I will do a grab bag. There's amazing speakers that you're gonna talk about. Like he said, parallel realities. We're all right. Everybody's right, nobody's wrong. It's about how do we integrate it that makes the most sense for a patient. If they have a contraindication to one, hey, I don't have to take whatever, I'll say the 401, and I don't know the roads in Montreal. If I can't take the 401, I'll take the 407, I'll take the QE. We'll get you there. But it's really all about working together, being on the same page so we can use it, and thinking about, we hyperdilute radius. We have a wide spectrum where you can achieve a lot and really tailor it, help with the budget, help minimize reaching for different things, and giving them a really good base so then even when you do something else, I think they're going to respond better. And then, of course, we have the old therapy prime that'll help sort of tighten everything. And then again, if you want to remember this, another picture, I promise I would come back to it. So the different G prime. I mean, every company has different measurements of G prime, but they're going to be relative to each other. Just you can see when the volumization really drops at that 1 to 2. So if you're 1 to 2 or higher, you're not really volumizing. You're just counting on regenerative medicine. Okay, and then this one, if you missed it the first time, I promise we'd be back. That's your other cookbook. And that's it, and that's my story. So let's talk longevity. The skin, as I said, it keeps a record of what we've done. We talk about forever chemicals, right? The sun is your forever chemical. Your skin is your forever chemical. But we're now shifting into a phase of medicine, regenerative science. We can, for the first time, start understanding why it keeps that record and how we can start intervening with that record so we can actually make ourselves stronger, more resilient. And then when we build the foundation, we're not just making our skill look more beautiful, we're actually optimizing the longevity of it. Thank you so much. Like I said, my Instagram's on there. Feel free to reach out. Questions? Yeah, oh, sorry, in the back, yeah.
Yeah, you just showed radius and CO2 in the same session. I was under the impression normally you want to stage these things, like do your CO2 probably first, and then you'll do your radius a few weeks later or something like that. You've never experienced any thermal issues with your...
We do it a lot. Excellent question. I mean, it's always a safety consideration. So when I first started doing this, it was for very few select patients who were like, listen, I can't come see you. I do we're opening actually a clinic up in Beverly Hills soon as well. And I have some clients that are like, listen, I have one shot, that's it. What can we do? What's safe, right? So that's what started the journey of how can I maximize? And then again, the pain, you always look at the pain points. Patient's not tolerating CO2. What else can I do? I don't have an OR. I don't want to get an anesthesiologist involved, right? No, so do we. But it's still, even with, who's had pain with regional blocks with CO2? You still have it. So how can I still maximize it? How can I still maximize rejuvenation, right? So initially, I mean, if you look at the data of what happens with that heat, again, it's subdermal, you're doing it at the fat layer. It's way above, right? Number one. Two, we know it can help with the healing based on the regeneration and what's happening. So I'm like, seems like a win-win. We're throwing in a lot. So that's what we're like. We started with just select people, to now that's all we do. And we do like I probably do like on a busy week, probably at least 10 CO2s a week. We probably do minimum 5 CO2s a week.
And what's your staging for Ulthera therapy and let's say your HA? So you assume you'll do your Ulthera first and then you'll wait a couple months or a month?
Yeah, generally, so again, ideally, yes. Ideally, you want to wait about 2-3 months. I mean, minimum a month, I would generally say. But there are studies showing that you can do both on the same session as well. You still get amazing results. So I can forward those to you. So yeah, you can do them at the same time. So that's really what's coming with regenerative medicine in general is combination treatments. That is the new sort of how we approach it. And I'm loving that you're asking questions because you want to do it safely, right? So yeah, start like anything else. Start slow, get your comfort on it. See, it's always select patients that you know and trust. And if they're like, listen, I'm gone to Florida or whatever, I'm gone. Like I don't have 3 sessions. I want to do it. So yes, there is a strategy to it. You don't want to necessarily do radius first. The worst I think to do is radius and then all therapy maybe too soon after. For one main reason, there's some maybe loose scientific evidence that maybe those baby collagen, the heat might be a little bit more on them and they're not quite able to sort of get that exponential. It's still good. It's still better than nothing, but it's like a hypothetical thing. So that's why I'm like the two together are actually at the same time had the best results. Another I think was a question.
If you have a patient that is going to go for facelift, would you still follow the old therapy or would you advise them, like, because I heard all kinds of things?
If they want surgery, they know they want surgery, get the surgery. There's no question about it, right? So I'm like, get that first. I also tell them, listen, you have to make sure, it's not going to fix your skin quality. So eventually you're going to have to do that. I think if they're going to if they're not sure, the surgery is about ideally like a year later, I'm like, yeah, we can get this done and see. So I talk with them and say, what's your goal? Like, how committed are you to surgery? If you want awesome results, you do everything. That's my opinion. If you want, aging is not one thing. It's actually 12. Who's heard of the 12 hallmarks of aging? I can send that to you too. Just, text me hallmarks and I'll send you that. But it's 12, from proteostasis to zombie cells to telomere shortening to mitochondrial deficiency to 12 of them. So again, you got to do everything. If you want surgery, surgery first. I think I'm on it. Well, I'm a little over. Thank you.